Good morning, everybody. I'm Muriel Bowser. I'm the mayor of Washington, D.C., and I'm here to provide an update on the district's response to COVID-19. Today, we also want to focus on two very important issues, and that is voting in Washington, D.C., and Washingtonians completing the 2020 census. So I'm joined today by the chairman of the district's Board of Elections, Chairman Michael Bennett, who will provide an update on the board's plans for mail-in ballot and in-person voting for the June 2nd primary, and Andrew Trueblood, who leads the district's Office of Planning, who is responsible for our outreach for the 2020 census. Before I do that, let me provide some specific updates about the district's experience with COVID-19. We reported this morning 153 new positive cases, and sadly an additional 9 people who have succumbed to the illness. And as we continue to see and report these numbers, our message is the same. By staying home, we're driving down the curve, and we will save lives in the district. So my reminder is that you only go out for essential activities and wear a face covering. Yesterday, I issued a new mayor's order that extends our public health emergency through May 15th. We will share more about what that means for our community at tomorrow's briefing. But we know that by extending this order and by continuing to stay home and practice proper social distancing, we will save lives. Today is a holiday in Washington, D.C. It's D.C. Emancipation Day, a day we celebrate the courage and perseverance of those who fought to end slavery, and also when we recognize that D.C.'s fight for full equality is not over. And it won't be over until we have 2 senators and a voting representative in the House, until we never again are designated a territory for any purpose. Our residents, we know, pay federal taxes. We operate as a state, and we should be a state. Under normal circumstances, we would be having a big parade and concert on Freedom Plaza, and we look forward to getting back to those celebrations next year. And while a lot of things are on hold right now, a few things are not, and that is voting and completing your 2020 census. And fortunately, you can do both of those things from home. You can complete your census online in less than 10 minutes at 2020census.gov. You can also call 1-844-330-2020. I encourage you to do that today. All you need is your address. In fact, our COVID-19 emergency funding is directly tied to the census, so it's especially important for D.C. residents to complete the census this year. So now let me turn to Chairman Bennett, who is the chair of the D.C. Board of Elections, to talk about the board's progress toward the June 2nd primary and special election in Ward 2. Chairman Bennett.
Thank you, Mayor Bowser, and thank you. Thanks for this opportunity to share with the residents and the voters of the District of Columbia where we are with regard to the elections and for June 2nd, June 16th, as well as the general election as well. The June 16th obviously is a special election in Ward 2. So I want to start off by just emphasizing for every D.C. voter or eligible voter, if you're not registered, please register to vote now. If you have to make changes to your voter registration, change of address, please do that now. Make sure that your voter registration is up to date, and you can do that either through the app that we've talked about before, that you can download. You can do it by email, you can do it by phone, you can do it by mail, you can fax the information in, but the sooner the better. And so make sure that your voter registration information is up to date. That's the best way to ensure that we'll have a very successful mail-in ballot process. The other thing I wanted to make sure to remind you of is that when you do complete your request for the absentee ballot or for the mail-in ballot, the system actually still calls it absentee. We've had no excuse absentee voting in the district for 10 years. We've had absentee voting for 20 years. So the process that we're using is still the same process. It's just that you'll be able to request the ballot for mail-in. The system itself, in many places, if not most places, it still says absentee, but that's where you want to click to be able to get your ballot application to mail your ballot in. You can request your ballot online today. All you have to do, as I indicated before, was just to go in and download the app or do it by email. The voter guide that is available to give you detailed instructions with regard to how to vote, the voter guide is online today. The voter guide will be mailed out physically to every D.C. registered voter by May 1st. That guide will have in it 2 copies of the application to request your mail-in ballot, along with self-addressed envelopes that you'll be able to put your application for your mail-in ballot in there and drop it in the mail. It's self-addressed and prepaid postage. The deadline for voter registration online or by mail or by email or to change your registration, the actual deadline for that is May 12th. So again, if you have things you wanted to change and you want to do that online with regard to your voter registration, you have until May 12th to actually do that. If it is after May 12th and you want to register to vote, or you want to make a change to your registration, you'll have to do that at one of the vote centers that we're going to open up for in-person voting May 22nd. But that said, because we're really focused on making sure that you're able to vote safely and that your vote be counted, please try to do everything by mail. The deadline for us to receive your request for a mail-in ballot is May 26th. As long as we receive that request by May 26th, then you would be able to receive your mail-in ballot and get that completed and mailed in. We will begin sending out ballots by the first week of May. Our target date is May 5th, but we should start sending out ballots for you to complete by May 5th. Whenever you receive your ballot in the mail, you should complete that ballot as soon as possible and get it submitted so we will have it prior to Election Day. However, as long as you have it postmarked by June 2nd, then it will be counted. When you receive your ballot in the mail, there'll be complete instructions. The one thing I want to make sure that everyone does is that when they receive their ballot in the mail and they do the marking for their particular candidates, make sure that you sign in the place that is designated for you to sign. Your ballot cannot be counted unless you sign it. For those who can't do it by mail, and I'm sure there are some, although I'd be really, really happy if indeed our vote centers were not full at all. But for those who cannot vote by mail, we have 20 vote centers that will be open from May 22nd all the way through June 2nd, Election Day. And there will be at least 2 vote centers per ward. Some wards will have 3 vote centers where there are council member races. So make sure that, and in those vote centers, the vote centers will be CDC compliant, will be practicing social distancing, and you will not be able to enter unless you're actually wearing a mask and have complied with the orders, the mayor's orders with regard to social distancing. The other thing we want to make clear is that as long as your ballot is postmarked by June 2nd, and as long as we receive it by June 9th, then your ballot will be counted. But that said, the request is that you, as soon as you receive your ballot, that you mark it accordingly and return it to the D.C. Board of Elections. If for some reason or other mailing your ballot is not something that you are comfortable doing and you want to drop it by a vote center, you're more than welcome to drop your ballot at a vote center anytime between May 22nd and June 2nd. When you do your application for your mail-in ballot, I also want to point out that you can determine, or you can note on that application, whether or not you want your mail-in ballot just for the June 2nd primary, or if you want it for the June 2nd and the November election, or if you want to have it permanent. The other thing that you will note as well, if you live in Ward 2 and you request your ballot by mail, which I hope you do, if you live in Ward 2 and you request your ballot by mail, then you need to mark that you want your ballot for the June 2nd primary as well as the June 16th special election. We are also going to ask that if you do decide to go into a vote center, that those persons that have last names beginning with A through L, that they go in the morning. Those persons that have last names beginning M through Z, that they go in the afternoon. Regardless of what time you actually go into a vote center, you will not be turned away and you will be able to vote. The other thing I wanted to clear up as well is that unlike in a normal election process where you are to vote at your assigned precinct, in this case, regardless of where you live, you'll be able to vote at any vote center. So if you live in Ward 4 and a vote center in Ward 2 is most convenient for you to vote, then you're more than welcome to vote at that vote center that you choose. And I think lastly, I want to point out that if indeed you apply for your mail-in ballot through our app, the app was actually built for iOS systems. I know it's getting a little bit techie. But if you have an Android phone, the app may or may not work for you. We're working on those and trying to make sure that those particular glitches are corrected as soon as possible. But the other item we've had some confusion is because sometimes the confirmation of your submission of your application to receive a mail-in ballot through the app, sometimes the confirmation is not right away in terms of a return email. But as long as the submission, once you submit, as long as you don't get an error signal, and there should be a screenshot that says confirmation. It may be several days before you receive a confirmation email, but be assured we have received your request. And lastly, I just wanted to point out that so far we have over 15,000 requests for mail-in applications. We have over 460,000 voters in the District of Columbia, but I think 15,000 so far is a pretty good start. So I encourage you to get your applications in to receive your ballots by mail. We are having webinars on a regular basis with various community leaders talking about things that will allow us to get applications for mail-in ballots to various groups. We are particularly concerned about seniors and senior communities, making sure that they have an opportunity to get applications and get their ballots by mail. So we're working with various senior community organizations about that as well. We also, very soon, you'll be hearing lots of information on the radio and television ads giving additional instructions or reminding people to vote by mail and requesting that you make your application for your mail-in ballot as soon as possible. With that, Mayor, thanks for the opportunity to express.
Thank you, Mr. Chairman. Now let me turn to Andrew Trueblood on the census.
Thank you, Mayor. I think it's important to note that really the census and voting go hand in hand. Census is used to give us our wards and ANC boundaries, and when we get the 51st state, we'll help get our enumeration for federal representation. So I think these are two critically important issues. As many people know, this year is the first year that census, the 10-year decennial census, is going online, and so there have been a number of ways that it will be different than what people have usually seen in the past in terms of getting forms in the mail that they fill out. Hopefully by now, every household has received an invitation to complete the census or multiple invitations in the mail. Through that, you have a code that you can use to fill it out, but you do not need the invitation, as the mayor mentioned. You can go to 2020census.gov at any time and put in your address to complete your census form. You can also call, and I'll repeat this number that the mayor shared, 1-844-330-2020 to complete the census or request more information. Census is used for the district to get us over $6 billion a year in federal funding. As the mayor mentioned, it's also used in times like now to assist for formula funding for things like disaster relief and recovery. It also helps us with our own public health responses. So it's now is as important a time as any to complete the census. And the good news is that because it's online or by phone, you don't have to leave your house, and you can complete it at any time at your convenience, hopefully today. We are close to the national response rate, although just behind, which should be about, the national response rate will be about 50% today. And we're hoping to catch up to that and maybe even surpass it. I think, finally, it's worth noting that we have been working with a number of community organizations, 16 community-based organizations, to reach some of our hard-to-count populations. This includes African American and immigrant communities. It includes low-income residents, seniors. It also includes children under the age of 5. So we have been working to pivot from what was going to be a great deal of on-the-ground outreach in the months of April and May to virtual outreach and working through other methods such as food distribution and other ways that we are connecting with residents to make sure that everybody has the information they need to complete the census. With that, I'll just remind you, please visit 2020census.gov to complete the census on your phone or on your computer, or call 1-844-330-2020. Thank you, Mayor.
Thank you. Thank you. Okay, we'll take questions. Sam?
Yes, Mayor. So a report came out on the D.C. jail yesterday. I listened to the hearing that was before Judge Kolar Kelly, and I guess that obviously there's a lot there, but the thing that struck me most was that apparently there's a group of people who were in isolation, who, according to the testimony, would in some cases be in a cell for 9 days, no telephone, no contact, no change of clothes. I'm just interested in your reaction to that.
Well, certainly we're going to be following up with the inspector's report. We actually haven't gotten a report. I think that the report is due to come out tomorrow. And I think what you're talking about is the hearing that you may have been on, our lawyers were on, and I'll get a full report out on that. So some of the things that I read in the reporting about what was said in that call, we certainly want to make sure that they match up with all of our expectations for staff to be doing in the jail each and every day, but that they also match up with how we can contain the virus inside the jail. And that's a tough thing. We said from the outset that the operations of the jail have to change in an effort to keep the virus out. And that has included visitation, which is tough, and which is a tough decision, but we see limited visitation in all kinds of congregate settings, including the jail. The mention in the report about the inmates being able to talk to their lawyers, we want to make sure that that happens, given that the limitations on movement. So we're going to track that down. So our DOC director is going to listen to what we heard and certainly listen and read the report that we get. So we have a few things that have to be answered, two in particular. How can we make sure that we are serving the inmates in a humane, respectful way, which is certainly the job of the jail and all the people who work for us there, but also that we're putting in strategies that help contain the virus. And that necessarily means limited movements and that the jail is operating in a different way. Another thing that we are going to do, and I'm not sure that they have this expertise, but I'm going to ask, is we've had a team from the CDC this week helping us in some of our senior buildings, and we're going to ask them if they can give us some advice, some more advice on infection control inside the jail facility. So I'm not sure that they have that expertise, but we're going to ask.
One of the things they did say was that they had, for example, chemicals there, but in many cases the staff did not know how to use it at all. They didn't know how to use it. They didn't know what parts per gallon or whatever to dilute it in order to use it there in the jail.
That sounds like, well, if I read that there needed to be training on cleaning materials. Is that what you're referring to? So obviously, it may not be obvious, all right, to know how to use cleaning materials. But if that type of training is required, that is going to be an easy fix at the jail. In addition to how to use, I read, and I assume that is true, that people need more instruction on how to wear a mask and how to properly use a mask. The information we got from the reporting from the call is one set of information. We expect a full report from the inspectors. I think tomorrow is when we're supposed to have it. We won't wait to fix the things that have been called out if we know it's a problem. And this issue about phone calls with lawyers, we know that we have to do some work on that. But that's largely to make sure that we can move residents in a way that doesn't contaminate the entire jail, which is our first priority.
I understand the population of the jail is down about 20%.
That's correct.
Is that as far as it can go at this point of your thinking, or is there more room for more of a decrease there?
Well, I think the decrease that we've decreased locally all that we can. I think that's where we are from the inmates who are in local control. And I think that the courts have set up a process to petition. And I know that they're going through that process in many cases with the defense bar. Yes.
Mayor, yesterday you announced that the Office of Healthcare Finance was going to begin an initiative to try and identify the most vulnerable in the community, people that had underlying health conditions, perhaps do some testing. Can you give some detail on how that's going to work?
Yes. As you know, we have very robust insurance in Washington, D.C., and have for many years, and a good number of our residents participate in one of our managed care organizations that the district supports through Medicaid. And so Wayne and his team at the Department of Healthcare's Finance are going to see if there's anything that we can do with that information and data and with the managed care organizations to make sure that our residents who are more susceptible to very severe illness and death from this virus are addressed. And more than that, part of our discussion yesterday in all of our vulnerable populations, some residents who are in our care, some others in congregate settings, and many who have very significant and complex health issues in that group, we know that working with those vulnerable populations will also save lives in the district.
And can you tell me when that initiative began?
We've been very focused on it this week. Yeah.
So the question that we also have, though, is you've known for several weeks that this has been very aggressive towards the African American community. You today, in your data, says 77% of the deaths are African American. Is this something that you think you should have begun earlier?
We're always focused on how we're saving lives in the district, and I think it would be unfortunate to characterize our efforts over the last several weeks as anything but trying to save people's lives. And we continue to do that.
And if I could follow up, we're hearing that at least one grocery store worker at Whole Foods has tested positive for COVID-19, I think on P Street. You've previously said you're not going to shut down the grocery stores. But in a case like this, do you think that should be done perhaps for a period of time until the stores are cleaned?
I think they don't operate all night, so I know that the stores are cleaned. I don't have any details on P Street. I know I need to get those before I can respond. Yes.
So this is actually Mr. Bennett, or
Sure.
Mayor, you could probably weigh in if you want to also. Maryland finds itself in roughly the same situation when it comes to running its election, now on the same date, but also almost exclusively by mail. But they made the decision last week to send every household a ballot proactively. I know you've said, obviously, in the past that you've heard from experts that that's not feasible for the district. But what's the difference between Maryland and the district, that Maryland can send everybody a ballot, but the district can't?
Well, I'm not sure that I don't want to comment on Maryland. I mean, they made a decision that was they believe it was consistent with what their objectives and goals are and what they could do. When we looked at that, and we looked at and talked with other jurisdictions that do it completely, their recommendation was that it takes about 2 years to put processes in place in order to do just a straight vote by mail process. When we looked at whether or not that actually made sense for us, you can make one mistake, and for instance, you could have Ward 4 ballots going over to Ward 6, and there's just no time to recover. So the risk of a failed or challenged election was just too high. We believe that the system that we currently are putting in place, or pushing for the mail-in ballots, is the one that's really going to work for the district. And that's a model that many states have. That's a California model. And by the way, when someone fills out their application for a mail-in ballot, they can check just for the primary, they can check for all of 2020, or they can check permanently. And if that's the case, then we would permanently send someone a mail-in ballot until they made a change.
To follow up on that, you mentioned that there's going to be you're going to do some radio ads or some sort of campaign.
Right.
You probably know, I'm sure folks from the Board of Elections know, that changing voter habits is extremely difficult.
It is, yes.
It takes a lot of times multiple election cycles to implement, and you're doing this in 2 months. Like, how are you going to reach, especially voters that may be harder to reach or may be very used to voting a certain way and may say, there's just no way in heck, I guess, that I'm not going to go to my voting center and cast the ballot in person? Like, how do you get to those people and maybe change their minds?
Well, one of the things that I think that we've done for a number of years with the D.C. Board of Elections is developed a lot of relationships with various community groups. So, for instance, and particularly in the senior community. Connecting with leaders of those communities directly and with those groups directly. And as I said, we're really pushing it and going to blitz the community with lots and lots of information. One of the things I did not mention in my earlier comment was we now have a call center, and the number is 202-741-5283, where persons can call in and get information. The new voter guides will give people lots of information, and we're sending those to every registered voter. Yes, it is tough changing voting habits. There's no question about that. But we're pushing really, really hard because it's most important that people stay safe during this time, and it's most important that their vote count.
Yes.
Yes, let me follow up on Martin's question, because you have many residents who actually change. They move around the city, and but they don't contact the Board of Elections.
Right.
So, in terms of what he asked, do you have any measures to deal with people who just may move just very quickly?
Well, one of the things that we're pushing, and I started out talking about, is for people to update their voter registration now. They can go online and do that, and do it very easily and quickly. Also, when you get a new driver's license, that information goes directly to the D.C. Board of Elections, and your voter registration is updated then. A along with our working with various community leaders to get the word out as well. But that's not an easy fix. But that's why we're really that's why this campaign to let people know. I mean, you'll probably hear more on the radio and the television over the next few weeks than you want to hear relative to voting in D.C. and updating your voter registration and getting your mail-in ballot.
Yes, I do. Chairman, if I could say on elections. So I'm just a little confused because it sounds like on one hand you're doing everything you can to encourage people to request a mail-in ballot, but at the same time you're saying that your system really couldn't handle it if every voter chose to vote by mail. Is that?
No, I didn't say that at all. No, I didn't say that at all.
Why don't you just mail every single voter a ballot?
Oh, no, the issue was not so much whether or not the system could handle every voter voting by mail. The issue was, or is, that the process is required to make sure that every voter got a ballot and mail that out it's not as simple as it sounds. I mean, for instance, we have over 32 different voter styles in the district. Plus. And just a simple example, as I said earlier, and we've got 460,000 registered voters plus. So all that voting, all that mailing would have to be handled by a mail house. And all that's done, and all that sorting is done by a machine. You could have one mistake that happened in that mail house, and as I said, Ward 4 voters would get Ward 6 ballots. There's just no time to recover. And the risk of that, from my perspective, and my other two board members, was just too great for us to try that at this point. And so that's why we're really pushing people to request their ballot so that we have the information, so we know where that ballot's going. The other thing that's really good about the system that we have right now with regard to mail-in ballots, you can fill out your application for a mail-in ballot, and we will mail it to wherever you tell us to. So it doesn't have to be at your registered address. So that's the other thing. And so when you're just simply mailing ballots out to everybody, you're simply mailing them to that registered address. And there's just a ton of bad data in everybody's system that is going to create a number of challenges. As I said, I'm not going to comment on what Maryland's doing or not doing or any other state. Everybody's working through theirs, and they've all got different situations. But in the district, we believe that this is going to be the best way to keep people safe and also to have excellent voter turnout. In fact, our voter turnout may even be better, but also to make sure every vote's counted.
So if you had 460,000 requests for ballots to be mailed out, that you could handle. I think you explained it. What is jamming you up if you just sent them out to the data you had on hand. That's the sticking point. If you got 460,000 requests, that you could handle because you'd have their specific data.
Theoretically, yes.
One more follow-up question. If some people have already gone online to apply, and I know you addressed this, I think, partially in your opening remarks, but did not get either a confirmation email or when they go back online to check their status, it hasn't been updated to a mail-in ballot. Do they need to reapply, or should they just wait?
They should just wait. The system will actually take another application as long as they didn't get an error symbol or signal when they submitted, and as long as they and once you submit, there will be a screenshot that says confirmation, and there is an opportunity to check that on your application for you to get an email confirmation, and most people do. For some reason or another, some of those are coming back. Some of the confirmations are actually going to person's junk mail, probably. Those kinds of things that are happening. And some of the emails we're finding out are just simply not getting through to various person's servers for whatever security that they have. So if you do it twice through the app, we're only going to take one, but the system will take it. So if somebody wants to do a second time, I mean that's okay, but we're only going to send out one. Yeah.
Mayor, Amanda Gomez, City Paper, asks, can you provide reward data for lives lost, getting emails from readers who want to know more about those who are passing?
We'll check on that. Yes. Go ahead. Go ahead, John.
Okay. Scott Thompson from the Post asks, how will DC enforce whether ride-sharing grocery stores and hotels are buying PPE for workers?
If they're buying it, I don't know how we'll know if they're buying it. We'll just know if they're wearing it.
And then does DC have any plans to distribute masks or sanitizers to low-income areas?
We are, and as we have talked about many times, been very focused, and we're seeing some, I want to say local, but it's not local. We're seeing some regional and national production of masks, especially the non-medical type masks. And as we are able to get more non-medical masks, we will be able to distribute beyond DC government workers and our health workers. We have a big request in from the Board of Elections, for example. And so we are finding more sources for non-medical masks to build up our local stockpile.
And then does DC plan to resume or scale up contact tracing as Maryland is doing?
Yes.
Yes. For the chairman, do these ballots have to be notarized, these mail-in ballots?
No, just signed.
Mayor, is your administration doing anything in addition to social media and using the news media to get the word out to the African American community that they're not immune to this? Apparently there's a myth out there, and that we're hearing in Baltimore, they're actually going door to door with flyers to tell people that this disease can attack anyone. Is your administration doing anything other than that? Is there any other outreach that we're unaware of?
Well, we just talked at the outset of our conversation about how we're going to use our insurance data to reach out to more people, and how we're very focused on vulnerable populations, which we think are incredibly susceptible. We have been talking almost since the outset when we saw our numbers trending to outpace our population, and knowing what some of the underlying conditions are and the prevalence in DC of those conditions, we knew we had a lot of work to do in targeting people to make sure that they are social distancing. But here's another aspect of that. A lot of African Americans serve in essential jobs. Okay, so they're not the people in our city and in our region in large share who can telework. So there are people who are working at the grocery stores, who are driving the metro buses, who are delivering the mail. And so that is, we have the kind of double whammy of having the prevalence of these underlying conditions, but also the prevalence of our workforce who are essential workers being African Americans. And that includes us in DC government. And so that is why the decisions around essential work and essential activity are so important. Because we know when we make those decisions, we're sending people who may be more susceptible to this disease to work.
I know you said yesterday that you believe that the word is getting out to people to wear the masks, and you still agree with that and what you've seen all around the city?
I do. Yes.
It's been about a week since the council passed its second emergency bill, giving kind of additional relief to people and giving you some more kind of, 10 days since they passed the bill. The one issue that came up that wasn't addressed was undocumented workers, excluded workers.
We passed it. I think I signed the bill on Friday. I don't know if those days are right. Is that right? Am I missing a whole week? Yeah, and I signed it on Friday. It became law Friday evening.
So one of the big issues that was addressed, obviously, was excluded workers, benefits, or kind of like some sort of unemployment compensation for undocumented workers and workers of that nature. Events DC followed up with its $5 million fund. You said that you were looking at potentially working with philanthropic organizations to do something in the district. Like, where are those efforts? Is there going to be another effort by the city to help undocumented or excluded workers that don't otherwise have access to unemployment benefits?
Well, I think that the Events DC Fund is a huge and impactful investment, especially as a relief bill for the earliest impacted businesses and restaurants, and workers. So I think that is a huge impact. We, of course, continue to look for philanthropic help as well, and we will continue to do that.
A quick question for Mr. Trueblood. What is the deadline for doing the census?
As I think many folks know, the U.S. Census has moved back their deadline. Their ultimate deadline for everything, including knocking on doors, will be in October now. I believe it's October 31st. But what we are interested in is the self-response period. That is how we make sure we count as many residents as possible. That was originally intended to be through the end of May. Now it'll be through summer, but we're really working to encourage residents to complete the census as soon as possible through self-response. And we believe that the U.S. Census, it certainly is, their plans are in flux, but they may be sending people to knock on doors in May or June. But we want to try and avoid that as much as possible by having residents self-respond. It was 72%.
And you said we're just below the average, the national average right now. Where are we right now?
We're at 46.6%.
We have a lot of work to do. And so that is one message that we want to send to everybody, to go online, make the call. We've provided the numbers, and be counted. It's a very quick and simple process.
Could I ask a question about unemployment?
Yes.
There's a lot of people who are waiting for the additional $600 that was promised in the CARES Act, and I know a lot of states are having problems getting caught up with this. Do you have an update? What can you tell D.C. residents who are anticipating that extra $600, when that will make it to their checks? And will it be retroactive?
Yes, it's retroactive. We expect the 17th is tomorrow, right? The 17th is the date that we expect that the system updates to be made, and for the $600 payments to be included in payments beginning with next week's payment. So I think they issue payments beginning on Tuesday, the 21st. So that is our expectation. Let me step back from that a little bit, Mark, to make sure people know what we're talking about. Mark's question was about the Federal CARES Act, and that it adds an additional up to $600 payment to people who are seeking unemployment assistance. And we have on our coronavirus.dc.gov, we put out a big document. It's dense. It takes a long time to read, but it answers a lot of people's questions. So I want people to go to coronavirus.dc.gov and read that document, because it will answer a lot of your questions. So there are two, basically now, with the federal government's move on this, there are two types of unemployment payments that you can get. One is what we call traditional unemployment, and that's a weekly benefit up to $444, depending on what you make in a very complicated formula. And you can get that now for 39 weeks. It's an additional payment they're calling pandemic unemployment, PUA, assistance, pandemic unemployment assistance. That's the $600 payment. And you can get that, I think, through July. I think it's 13 weeks. And that is up to $600 depending on your pay and the formulas that they use. So the max benefit with those two things would be over $1,000 per week, depending on your pay and the formula that they use. So that is, please look at that very dense document, but it's very comprehensive in answering a lot of questions about unemployment insurance.
Do you know where you are as far as approving claims? I think the last time we saw DOAS here, you had about 53,000 applications and about 18,000 had been processed. Do you have those updated?
I don't have the most recent one. I do know that we're over 62,000 claims made. And the last number I saw, well, I don't even want to give you that because that's more than a week old. So we'll get you the most up to date on the number of claims paid and the amount of money for those claims. Yes.
And then could I ask about, you spoke about a little bit yesterday, and just coordinating with the governors of Maryland and Virginia, looking forward to a reopening strategy. Can you just give us any insight how, I know you don't know when, but
Sure.
how that and what that might look like in D.C. and regionally when it does happen?
I think we're very early in starting that process. We will be announcing a group of internal folks that are helping us, as well as external partners that will be part of that, who will be a part of that discussion. So we'll talk about that soon, and I will continue to have those conversations with the region as well. Yes.
Mayor Bowser, of course you're going to submit your budget May the 6th. And earlier this year, you had budget engagement forums around the city where you gathered information on what the residents want. Am I to assume that you're using the data that you gathered from those forums when you formulate your budget for May the 6th? And I have a follow-up to that.
Interesting question you ask. And because it is, we have thought about it, to be honest with you. I don't know how we will get it done. We had literally we had more people this year than we've had for the last several years at our budget engagement forums. I think some of them were 400 people a night over the course of a week. So we had a lot of people engaged and gave us some really good feedback. We were also collecting that information in very robust economic times. I should remind everybody, we went into this pandemic in very good shape financially in the district. And so we had a lot of ideas about how we would make those investments. And in the course of these several weeks, obviously our revenues are down, and we will, instead of adding new programs, we're going to have to cut some things to balance our budget. So I don't know that we will be able to do those budget engagement forums prior to May 6th, which is right around the corner. Actually, we're running up against the line to get it done. But that's not the last word on that. I haven't decided what type of engagement we can do before that date, if any. But the council will continue, I'm sure, will have some announcements about how they will engage on their deliberations of the budget. So the public will have an opportunity to weigh in.
You just answered my second question. Thank you.
Okay. Well, I can't speak for them. I assume that they will have some strategies to get public feedback. Yes.
So yesterday, Dr. Nesbitt in your office released a really helpful graph breaking down hospital by hospital, how many beds in each hospital were dedicated to COVID patients.
Okay.
Is it possible we could get that on a daily basis along with all the other excellent data you are already providing?
I will check with health. Absolutely. Yes. Go ahead. I'm sorry, Mark.
Sorry, if I could go back to Chairman Bennett, and I don't know why we moved from outside to inside, but I noted that there were 2 protesters outside at the press for the outdoor press conference who were concerned about petitionings. I mean, you know the people I'm talking about, I'm sure, and their issue.
I didn't see them. I'm sorry. I don't
But they, these are the people with the mushroom petition.
Yes.
But their overall concern is not just their petitions, but just being able to petition in this time of stay-at-home orders. And if there's, and I know I've asked you this before, but has there been any further thought given to making some accommodation for petition gatherers during this time if they were to try to, I don't know who's put their petition on hold right now or not, but they would like to get it on the ballot.
Yeah, sure. Unfortunately, I don't have an answer for you with regard to that. Right now, the law requires that petitions be gathered in person, and that people, be there to witness signatures. That's a conversation that we've started to have with the council relative to addressing and changing the law, and I'd be a little bit I'd be too far over my skis to start commenting now. But that is something that we're talking with the council about addressing, and we'll be talking with the mayor's office about how do you change the law to accommodate this current situation.
Are you allowing people to self-certify their signature?
I'd really rather not. We don't have the authority to do that now, based on the law. So I'd rather not comment, past that. But it is something that we're concerned about, and that we're talking both with the council and the administration about.
All right, last few, Martin.
So I think it was last week, maybe, you put out a phone number that anybody could call, mostly for people who are homebound, who don't have accessibility to food. They can call it and they can get food delivered. Now, some of the mutual aid groups that have popped up around D.C. have said that number actually basically just redirects to them. And these are community-based groups that are self-funding. And they're a little concerned that the government is essentially just kind of offloading responsibility to them.
And we'll take them off the list. So how it works is that people who meet certain criteria, they're being quarantined medically, or they are homebound related to COVID, then we are serving them with food delivered to them. Many others have called the line that don't fall into those categories, and we have shared existing community resources with them. If the community's resources don't or can't serve them, then we won't send anybody there. Yes?
About the grocery stores, there was a Trader Joe's, I guess, a couple of weeks ago, and the employee tested positive, so they closed the store. There's one report out today that all the Whole Foods have had employees who tested positive. What are your thoughts about what stores should do when this happens?
I want to, and I don't want to go off the top of my head on this, Sam, because it's very serious. And the Department of Health has given workplace guidance. So if a person in a workplace tests positive, depending on the type of workplace, is different for office, it's different for example, our people who are out there getting up and down on trash trucks and the like. So depending on the type of workplace, there is workplace guidance over what should be done. It is rare that workplace guidance would be to shut down that workplace and you can't use it anymore. But there's steps to make sure that any exposed staff or patrons or any other workers would be notified of the workplace changes. So that's what I would want to refer you to in the case of grocery stores, and make sure our health guidance speaks to those issues.
Is it your understanding, or do you have any knowledge at all, whether this is more widespread than just, say, Whole Foods and Trader Joe's?
Well, this is how I would respond to you. We know we have community transmission of the virus. So anybody who's out in the community can get the virus. And so I don't think that grocery stores would be immune to that. So what we have asked those stores to do is to do some basic screening of employees so that they know. And if they do have a person who becomes sick, that they follow the appropriate protocols as have been directed by DOH or the CDC. Thank you.
Thank you.